the talk today. So treating COVID-19 syndrome with Chinese medicine. This is just purely based on my own experiences during last 6 months. I've been day and night, 7 days a week, constantly on the phone and talk to people and people who suffer from mild or suspect COVID-19 syndromes. So, and then we help them or post them herbs to help. So overall, after from March up to August, and then I just summarized a lot what I have seen and what I've gone through and see what people is a problem and suffer and recover all the progress. Yeah. So at the beginning, we didn't know what exactly would be this COVID-19, but I just quite confident with Chinese medicine, said whatever people suffer from symptoms, and if they need help, I will help, because at early times, so there's lack of NHS test or availability to treat so many people. So lots of people have to stay home to get recover. So but when the people panic, they need treatment, they ask for help. I've been help them, and through the helping them, I get more understanding. So there's COVID-19 virus infection symptoms are so different. Not only one symptom, so different. They can affect all the organs, not only the lung. And as we at the first part we discussed, so can connect to the other part of the body. So let's see. So I have to summarize these different types. One is suspect COVID-19. So this is suspect COVID-19 is because people have similar symptoms like high temperature and cough, constant cough, and etc. But they didn't get the test, so they don't know if they have the suffered the COVID-19 or not. So therefore, we call it suspect COVID-19. And the second type is COVID-19 mild cases. So it's because normally they are young adults, so they got fever, cough, tight chest, also, and even loss of sense of the smell or taste, temperature, repeatedly temperature all the time, or shivering. So, but they've been tested, PCR tested positive, but they can't. They don't have to go to ICU. They're not as serious. So therefore, they are COVID-19 mild cases. They have to stay home to get recover. And also later, from July to August, so they see more post-virus syndromes. So people have suffered and the temperature's gone, cough has gone, but they still got post-virus syndromes, extremely tight, achy all over the body, heavy stiffness and lose the concentration, and the lack of creativities. They can't continue the job, or on the sick, vomit, and diarrhea or constipation. So all sorts of symptoms. And also COVID-19 related stress syndromes. That is also, I have seen over the past 6 months. Some people who not really, nothing to do with COVID-19 virus. They are not infected and not being close with anyone, but they're so stressed about lockdown. So they panic and insomnia, tiredness, and depressed, low mood, or maybe skin rashes, all sorts of things. In severe cases, they can't sleep for weeks and months. They have to end to the mental hospital, and also they feel very depressed or feel, and even I see they have the bowel parcel because I see some young students, Chinese students, the lockdown here, their eye tickets be counseling for 6-7 times. Wake up, eye tickets cancelled. So there's so much stress, and when they wake up, they become bowel parcel, and so this face and eyes just become dysfunctional. So and this is not the virus infection, but all the severe stress. So we had to do acupuncture for that to help to recover, because of their young, the acute stage. Normally, about 7 to 10 sessions, they came back to normal, and then they all recovered. Most of them are now back to China. So I have to make this chart to put think and analysis and summarize all these different types and all different symptoms are being summarized like in this chart. So that is this is because there's different suspect cases COVID-19 infection, mild cases post-viral infection syndromes, and COVID-19 related like stress. So this is not only showing anything on the lung system like a cough, so but it's showing all the organs symptoms. So first of all, like suspected and mild cases of COVID-19 infection, so mainly it can see repeated high temperature and constantly cough, very stubborn cough, and blocked nose, sneeze, runny nose, and redness and swollen sore throat, and red eyes. And this throat is affected lung, and a lot of them have nose bleeding, loss of sense of smell. So this is COVID-19 suspect and mild case all have similar symptoms, only suspected because they didn't have test. Yeah, and when this post-viral syndrome is in the lung, people feel very tight chest, short of breathing, shortness of breathing, and tight panic. And if so, why we say the liver's function affected? So, like suspect and mild cases, we can see the red eyes and eyes infection, irritable joint itching with high temperature. That's why these eyes relate to the liver there. So because in Chinese medicine, according to the theory, the liver's functions opening the eyes. So anything to do with the liver will affect the eyes. So if the people more stressed, more angry, or eat hot food, so have red eyes symptoms. Post-virus stage, so we have mood disorder and dry and prickly eyes very dry, like ticks in eyes, very dry. Yeah, and if the COVID virus related, there's no virus, but they can feel depressed, irritable, angry, and numbness on the lips, face, hands, and feet, feel numb. That is related symptoms. And also we can see in the heart system, so you can see the panic, palpitation, heartbeat fast, and insomnia, and dreams and nightmares, and forgetfulness. And even later we can see brown spots, purple spots, patchy spots and patches on the body, and many on the legs, and swelling and painful in the toes. That is all the heart, because the heart controls the blood circulation. That varies in the blood vessel controlling that. Post-value symptoms. So afterwards, they still worried, dream a lot, forgetfulness, and can't concentrate or lack of memory. And I have seen some people like journalists, they need writing, have to create, but they can't write article anymore, because they said their head feel foggy. In Chinese medicine, we know if you're foggy, yes, there's a dampness, so we can get rid of the fogginess in the heart. So if for COVID-19 related syndromes, so they can see the severe depressed, and sometimes happy, sometimes sad, sometimes cry, sometimes laugh, nightmares, and memory loss, and confusion, and even they can go into the mental health disorder. Some students here, they even couldn't recognize their parents on the Skype, on the phone. It's very sad, very, very sad. So, but if before that stage happened, if you feel depressed, if you're not happy, or you want to cry a lot, you're not sleeping well, then at that stage, you have some treatments, have Chinese herbal medicine treatment, then can stop it, get worse. They come back to normal as happy girl, happy boys. And also the spleen, the digestive system symptoms, we can see COVID suspected or mild symptoms. We can see abdominal pain, vomit, diarrhea, constipation, and taste disorder, and muscle ache, and extremely tiredness. At the post-value syndrome stage, so they will see extremely tired, can't carry on the work, aching all over the body, stiffness on neck, and heavy head, sick and nausea and vomit, and constipation or diarrhea. That is all to do with digestive system. As in terms of Chinese medicine, we refer to spleen function. And for COVID-19 related stress syndrome, they also can see extremely tiredness, no motivation, they can't do anything. They have no virus, they are locked down, but they think they are ill, they're very, very extremely tired. And the kidney, what to do with kidney? So through that, I have summarized and correct all symptoms related to the kidney between the COVID virus suspected mild syndromes and the post-value syndrome and COVID-19 related the stress syndromes. The symptoms are showing not on the lung, spleen, liver, or heart, but they can show the blocked ears, tinnitus, deafness, hair loss, or for the young girls can have irregular menstruation, amenorrhea, the periods stop come, dysmenorrhea badly, so lots of menstrual problems, and ears and hairs problems, and so that is all according to Chinese medicine theory. That is all to do with kidneys function. So we use this sort of method to strengthen kidney and to support the body, and lots of cases recovered back to normal, especially for tinnitus. Suddenly I see so many young people have tinnitus, not like before the pandemic. We don't see so often their tinnitus, but they are young normally. And generally, tinnitus see more elderly people. But during the pandemic, young people also can see tinnitus. In that case, we still treat the wind-cold dumplings blockage to use pungent and warm and herbs to open the ear to help the ears healing and to treat the tinnitus. And a lot of people have menstrual problems, so we need to regulate it by tonify the kidney. In Chinese medicine, we know kidney controls the reproductive function and the menstrual cycles. This sort of girls, they should go to bed early. They might be not sleep overnight or worry, so it can cause that. So we know that all the symptoms, so many, looks all complicated, but there's a certain rule to follow, and therefore we can find the way to treat it. So overall, we can tell these causes and pathogenesis of the COVID-19 is external causes is dump toxic evil of plague, so toxic evil and carried on by the wind. Internal causes mainly is lung qi deficiency, immune system is weak, and falling in the consolidating of the weak qi. Lung can't control the weak qi, the defensive qi. And then the location of the disease is in the lung, but affects the function of the spleen, heart, liver, and kidney. So at the same time, if the function of the spleen, heart, liver, and kidney are out of balance, can affect the level of the severeness of this pandemic, COVID virus evil, can decide how severe is to affect the lung qi, our body. So if your body's all organs function are strong, so then even we get infected by the COVID-19, we might still be able, okay, to get over it. So therefore, lots of people have no symptoms infection, because normally these people, their body are stronger. They look after their body or eat well, do exercises, doing right things. So here, I've been summarizing the treatment method with the Chinese medicine. Yeah, so the treatment, so as I said earlier, that need to be differentiated and prescribed, and then to make prescription. So first of all, we need to make, during the pandemic time, when patients suffer from problems, first of all, we need to find out which organ is mostly affected, although in the one organ, but what symptoms most need to be treated. For example, if they in the lung, many cough and temperatures and tight chest, so we need to expand the lung and dispose the pathogenic factors of these wind cold dumplings, and also soothing the chest, ease it, and regulate the qi, opening the nostril. We have herbs has these functions. That is generally treatment principle I set up, but according to different symptoms, we also need to choose different formula. For example, high temperature, 莲花清瘟胶囊, wind cold, aversion to cold, more cold, shivering, 麻黄汤, or wind heat or sore throat, so we use 桑菊饮 or 银翘散. Or another case can see cold wrapping heat. It means externally feel very cold and shivering, but internally it's very hot and high temperature, and with yellow thick flame or flame with blood. So this is, we need a warm, expand externally wind cold and clean the heat inside, the 麻杏石甘汤. If externally cold, internally cold all over, inside and outside. And the phlegm is white, watery. Some people can have a half jar of this phlegm, white, thin, watery phlegm in one girl. Let's show the picture. So then we need to warm up internally and externally. Shulan Tang, the little blue dragon formula. If blocked nose, lose of sense of smell, this formula is my formula. It's for the create for the high fever, but for help its sense of smell back works well. Normally within 1 week, people can get back their smell. And the other formulas, most of them are classical formula from Han Dynasty or for hundreds of years of histories. And Lin Hua Qi Wen Jiao Na is a modern formula to help to treat the COVID-19 syndromes. So if in the spleen, so we have to strain the spleen and harmonize the stomach and the liver, qi, and spleen and the liver to promote blood circulation. If a muscle ache, we need something to strengthen the mark, 加味清9味羌活汤我后做完。If vomiting, diarrhea, sick, abdominal pain, so we can use the formula 藿香正气丸 or 香砂六菌丸 or have ginger tea. Chest tightness, palpitation, 温胆汤. Chest pain like thorns, very sharp pain, 血府主义汤. That is virus, may affect the small blood vessels, so have very sharp pain. And but some people alternate spells of fever and chill, cold and pain in the ribs region. So we call it is a virus in the between externally and internally. We use 小柴胡汤. And it's already done. So it's a heart and the kidney. If the problem affects the heart and the kidney, so we need to tonify the blood to nourish and calm in the shen to settle the mind, and also tonify the kidney and to nourish the water, to moisten the wound. It means help the kidney to help the calm the liver's stress. So, for example, if insomnia or forgetfulness is grips tongue, heart palpitation, rapid heartbeat, 酸枣仁汤, or feeling sad or cry, then 甘麦大枣汤. Yeah, even young people. Yesterday, a young girl, only 16 years old, just very cry and very stressed. I give this formula to her, and she's happy, and her mother gets some more for her. When she's angry, she can bite the nails and scratch herself, very angry. So the formula can help calm down. And shortness of breath, 气味毒气丸, or cough out of blood and phlegm, chest pain. So there's too much heat in the blood. See the bleeding, cough. There see the blood in the phlegm. Then we need to cool the body. 滋阴丸 and 加微逍遥丸 and soothe the liver. Yeah. So and there's cases, and I think here I don't think we are here a lot of their practitioners, so I'm not going to explain how do we treat each cases, typicals, because time getting on. This is got so through, so this through pandemic. In the picture. So I think I go quickly, yeah. So this see all sorts of cases. See a young girl in the April, she got the sore throat and the cough. I got sore throat and couldn't breathe, very swollen, and she's allergic to penicillin, so she had to take herbs on and on. After all the treatment, I have pictures here, and all cleared, so it's no problem. And also we use this. Another case is that was had all ice treatment. Everything every time was a video call, yeah. And they also treated a gentleman with cough, and he never talked Chinese herbal medicine before, because one of his relative is studying at our college. So therefore, so when he got cough, he had asthma and cough for long term, but in the April through pandemic, cough very badly. So I prescribed herbal medicine. Only 1 week after that, all cleared, and the cough stopped, and long term asthma and the cough or get right. It's all cured. He hasn't got that. It all disappeared. So he feels it's magic. He's very impressed. Yeah. So that is yeah. So the second time was better. We got more medicine, and third time they said, "Oh, okay now," because he first time taking medicine herbs, so it works quicker and better. Yeah. So I think now is about time now. We've been talking about 1 hour and 40 minutes. So that's all about my talk. So now thank you for your patience and listening. And now I just offer my slide on the screen and give the time to Lucia and the audience to discuss on it. Thank you very much.
Thank you, Shulan. Now, any people, do you have any questions after listening to this? And have you been using Chinese medicine, and do you understand everything? Is there any questions that Professor Shulan can help you to explain? So, can the professor advise a good book on Chinese dietary therapy? 舒兰，你能推荐一本书吗？关于这个食疗的书。
Yeah, but I think so far there's most of them are in Chinese. Maybe if anyone interested, we can translate into English or write one in English. Lots of people ask, but I never managed time to do that yet. The book for dietary, yeah. We can answer some questions first, not today, I think.
Yeah, this audience said she's very interested. I'm sure if there's a good book explaining about what kinds of food from the kitchen that we can use for what type of nurturing, housekeeping, nutrition balance would be very interesting. And I think probably that's one of the first stage for the general public to understand the nature of food, what impact it can do to help our stay well in health.
Yes, there's a lot of Chinese dietary food, 药膳的书, but I've been read most of them, but they are the traditional Chinese food, you know. Maybe not suited for Western people. People say, what's this? I don't like it. Because even like in the Chinese restaurants, proper Chinese food is not everyone would really like to eat. They used to eat it. So, but some Chinese dietary food is all traditionally. So we need to make it into westernized. So that's why I made some sample. I said I make a menu for start, for main course, or dessert. I had a food syrup sort of article. So maybe in other time we can share it for the food syrup to suit for the Western people's food style. Actually, because if they simply the book, Chinese dietary book, I don't think everyone would really take in that because the Chinese food, yeah. So, but very.
No, actually, Shulan, you have got a very good idea. Soup. Soup is actually quite a common food for most of the British people, and a lot of people like soup. So if we say we blend a date into a diet soup, those kinds of recipes probably can go down well. And yeah, something flavor taste-wise can be more easy acceptable by the Western taste. It could, put it in there to
Yeah, food, the soup, yes, the soup. Again, you have to according. We first of all need to understand what soup has what sort of protein, and then which sort of people is suitable for eat this soup. As I said, the dandelion egg soup is cool. It's good for hot people. If people have a sore throat or acne, and then that's very good. But if people are cold, have diarrhea, so they shouldn't have it. So that's why this. Need have more knowledge on it, and so not everyone just eat one soup.
Yeah. And so there's a question saying, is there generally any issues taking TCM or already taking Western medicine, a meditation for a long-term illness?
Yeah. So if you already have long-term illness, you're on the Western medication. It's you're on medication. At the same time, you may have other symptoms. So you need to take some Chinese medicine. But Chinese medicine, we only use herbs in UK and Europe. It means Chinese herbal medicine only. It's medicine, actually it's herbs. So that's all natural herbal plants. So there's no interaction with these chemical drugs. It's no problem. If you own drugs, your medication, it's not affected by the taking Chinese herbal medicine. As we said, Chinese medicine and food are same source. Not affected.
Any more questions? Any more questions? Okay, there's very good presentation. Thank you, successful doctor. Thank you, professor. Child dosage. What is child dosage? The question about child dosage.
Kids.
Below 3 year old, below 3 year old and 3 to 6 years old, can they take Chinese herbal medicine?
Yes. Chinese herbal, as I said, if you use it properly, it's very safe. Only herbs. I've been seeing child with like a few months old. So if you have eczema or diarrhea or sort of things, we give the herbs for them. But we choose more carefully with taste. We don't choose anything too bitter or too strong to help. It's a child up to 3 years old, under 3 years old, the dosage normally is a quart from adults.
A quarter.
A quart. And if up to 6 years old, then the half dose of the adult's dose. And then over 6, then you can have 3 quarts. Like 6 to 9 years old, you can have 3 quarts dose as adults. And then over 9 years old, they so it's have normal dose. It's very safe, and also all the Chinese prescription, herbal prescription dose, or varies on the different doctors.
Yeah.
So different. Some doctor gives strong dose, some doctor gives small dose.
Can we have contact for consultation, please? Your contact for consultation?
Yeah. So I don't know how can I tell you here. So you can contact me on the phone or through the WhatsApp or WeChat, or
Shulan, do you
maybe Lusa.
Yeah,
have you got contact with Lusa? Lusa can give to you.
Do you want me to share your number or just email?
I don't read all the email every day. I don't have much time.
Should I give you the number, or should I?
Yeah, give my mobile number to your audience, because you organize it. It's okay. Yeah.
Okay, so
you can give my name.
So everybody, I will give you Dr. Shulan's mobile number, and I suggest you send her a message than
Yeah.
calling her, because she might be in the middle of a treatment. If you send her a
Yeah.
text message and tell her, try to make appointment via a text message, then she will get back to you as soon as she's free.
Yeah.
And then so
I
they
didn't get the number. It's gone quick.
Shulan's mobile number is in the chat area. I just posted there.
You are?
Materia.
Yeah, so you can take down her number, send her a text message. It's always best. She will get back to you.
Can you show them?
Sorry, the number has disappeared very quickly.
Okay, I'm going to read it out for you. It's 07 76 616 5608. So it's 077 66 165 608.
Got you.
Yes.
Thank you.
Yeah.
Yeah, the best thing is to message Shula, and then she will get back to you. She is extremely busy. As she said, she was treating patients 7 days a week, day and night. A lot of time late night, she's still in the treatment and talking to patients. So she cannot get
What
time to get back.
surgery base? Is that in Manchester?
In Manchester, yeah.
Oh.
She is in Manchester, and we have got a list of the doctors, Shulan's colleagues, and registered member of Federation of Traditional Chinese Medicine Practitioners in the UK. And their website is on there. They publish a lot of regular medical journals, and they kindly especially put this list of doctors together for us today. So they are recognized. Shulan possibly knows quite a lot of them, and they are professional senior doctors in China before. Now they are in the UK practice. You got their mobile number there, and you can add them on their WeChat account and get in touch with them if you can't reach Shulan. She's very, very busy, but if you are very, very desperately can't wait, you can pick up the phone, speaking to these doctors. I will make this list available with the YouTube together. So it's going to be public for everybody able to access to it if they're looking for it. Any more questions?
Okay, thank you.
What we can assure you is these are the professional qualified doctors, have many years of professional treatment experience. It's not just like they are really fully qualified. I would go to the professional doctors if you want to try traditional Chinese medicine. Thank you very much, Shulan. And any more questions? Any more questions, everybody?
I think that's all for the time being.
Okay, yeah.
That's all. Thank you.
So everybody,
You're welcome.
stay positive.
Thank you.
Lots of sunshine. And thank you so much, everybody, and for being with us tonight. And stay safe and have a very good evening.
Thank you.
Thank you.
Thank you.
Thank you.
Bye.
Thank you. Bye.
Bye.
Thank you. Bye-bye. Shulan.
Bye.